question and answer. I'm Dr. Olukotun, AO, a resident doctor with Eye Foundation Hospital Group. Today, I will be taking you through the dry eye palava, whereby you are going to have a season, a time for question and answers, and you're going to be insightful. So I thereby invite you to join us as I take you through the dry eye disease. For more info, you can reach out to info@www.eyefoundationhospital.com.
The keyboard. Press down. Down.
So we're going to use these following outlines to discuss about the dry eye today. What is dry eye? How common is the dry eye? What are tears and how do they relate to the dry eye? What are the types of dry eye that we have? And what are the symptoms of dry eye? What are the causes of dry eye? And what can I do to help myself? And how is dry eye being treated? So I want us to know that dry eye, it occurs when the eye does not produce enough tears or produce a proper, or when the tears are not correct in constituencies. Thereby, it makes tears to evaporate quickly. Dry eyes can make it more difficult to perform some activities such as using computer, reading for an extended period of time, and it can decrease the tolerance for dry environments such as in an air-conditioned environment, maybe in the air cabin, in the aeroplane. And if left untreated, this condition can lead to pain, ulcer, scar, as well as loss of vision. However, permanent loss of vision from dry eye is uncommon. How common is this palava? Nearly 300 million people worldwide experience dry eye. And I want you to know anybody can experience dry eye. So it's almost like everybody's at risk, though more common in female than male, and people aged 50 years and above are more at risk than other general populations. Now I want to take us briefly through the tears and how it relates to the dry eye. Tears is made by lacrimal glands, which are necessary for overall eye health and clear vision. Tear back the surface of the eye, keeping it moist and wash away dust and debris in our eye. So they also help to protect the eyes from bacteria and other types of infections. Tears are constantly produced to bath, nourish and protect the surface of the eye. But in a situation whereby they are also produced in response to emergency, in a situation of emergency, such as when a particle of dust falls into our eyes, or when an infections or irritations of the eyes occur. An onset of a strong emotion as well, maybe like crying, can also trigger production of tears. When the lacrimal gland fail to produce sufficient tears, dry eye can result. Any disease process that alter the components, the qualities of tears, can make them to be unhealthy and result in the dry eye. So we have two types of dry eye majorly. Aqueous tear deficient dry eye. This is a disorder in which the lacrimal gland fails to produce enough watery components of tears to maintain healthy eye surface. I want you to know that tears made up of constituents. We have the aqueous part, which is the watery part of it. So if there's a problem with lacrimal gland, which secretes this watery part, then the quantity of the tears is compromised. Again, evaporating dry eye may result from inflammations of meibomian glands. That is another gland in the eyelid, which is located in the eyelid. The glands make lipid or oily parts of tears that slows the evaporations and keep the tears to be stable. For instance, I want to give you an analogy. If you pour a water on a floor, after a few minutes, the water is going to dry up. But if you pour an oil on a floor, it might be there for days. So tears make up both waters and the oily part. So this oily part, if it's deficient, it means that the tears that we produce is going to evaporate very fast, and then the surface of the eye is not going to be moist, it's going to be dry, and it will result into some symptoms. So what are those symptoms of the dry eye? Dry eyes the symptoms include one. It may be asymptomatic. In some people, they may not really have any complaint, but when you examine their eye under a slit lamp, you might see some traces of a compromised tears productions. It can lead to a stinging or a burning eyes pain. You see, many people will come to the hospitals, they will complain of a burning eyes pain. It can cause a sandy or a gritty feelings as if there's something inside your eyes which you cannot find. This is because the surface of the eyes is dry. Episode of excess tears following a very dry period. You might just notice that you are just producing excess tears. Tears are just running out of your eyes after a period that you feel some of these complaints like stinging, burning sensation. This shows that the eyes is dry. You can also have a stringy discharge. Sometimes you see a white mucus coming from the eye. This is not an infective discharge, but it's a discharge as a result of the dry surface of the eye. Pain and redness is common complaint. You can have episode of blurry visions. After some time, it may make your vision not to be clear. Heavy eyelids, inability to cry when emotionally stressed. No, sometimes we say the aged people doesn't cry. Not really. Most of the reason is because their tears is compromised already. In uncomfortable contact lenses, for those who are using contact lenses, suddenly it might become uncomfortable. You might complain of headache, high fatigue, decrease in tolerance to reading or working on computers, or any activities that require you to sustain stare at the screen. So what are the causes of the dry eye? There are many causes of dry eye, and we need to find out which one is responsible for your dry eye palaver. It can be temporary. The causes can be temporary as well can be chronic conditions. So dry eyes can be a side effect of some medications. Some medications can lead to dry eye. If a medication like antihistamines that is usually used in treatment of upper respiratory tract infections like catarrh, nasal discharge, all these nasal decongestants, they dry up the body secretions. So they can as well dry up the tears and make the surface of the eyes to be dry. Tranquilizers, certain blood pressure medications like these diuretics who lead to excessive loss of fluid from the body, Parkinson medication, birth control pills, and antidepressant. Some of these medications can precipitate dry eye. Skin disease on or around the eyelid, these are other conditions that can lead to dry eye. Because some of the pores, some of the area where the secretion come out, they can be infected, they can be blocked. And if this happens, then the tears component or tear quantity is going to be compromised. Disease of the glands, I mentioned some gland, lacrimal gland, meibomian gland. If they are diseased, if they dysfunction of this gland can cause the dry eye. Dry eye can also occur in women who are pregnant. Pregnancy is a condition that leads to so many hormonal changes in the body. So some of these hormonal changes can lead to dry eye. Women who are on hormone replacement therapy for any reasons may experience the dry eye symptoms. Women who are taking estrogens especially are 70% more likely to experience dry eye, whereas those who are taking both estrogen and progesterone are about 30% increase the risk of developing dry eye. Dry eyes can occur or develop after a refractive surgery. This is a procedure to correct a refractive error. Although this particular type of dry eye is a temporary type, whereby it lasts for about 3 to 6 months, but in some cases it may be prolonged. Dry eye can result from a chemical or a thermal burn that scarred the membrane lining the eyelid, covering the eye. Some allergies can be associated with the dry eye. Infrequent blinking associated with the staring at computer or a video screen may lead to dry eye symptoms. So if you are the type to spend a prolonged time on screen, that entails that you stare for a very prolonged time, you may experience some of these symptoms. Both excessive and insufficient doses of vitamins can also contribute to the dry eye disease. Loss of sensations in the cornea, that is from a long contact lens wear, can as well lead to dry eye disease. Dry eye can be associated with immune system disorder. There's some immune system disorder like Sjogren syndromes, lupus erythematosus, rheumatoid arthritis. Some of these autoimmune disorder can lead to a dry eye disease. Sjogren syndrome is just an inflammation and dryness of the mouth, eye, and other mucous membranes in the body. So, other causes of dry eye may be symptoms of chronic inflammations of conjunctiva or conjunctiva, the membrane lining the eyelid, and the covering front parts of the eye. So, if there's a recurrent or a chronic inflammation, this might lead to dry eye. And a chronic conjunctivitis can be caused by certain disease, infections, exposure to irritants such as chemical, fume, tobacco smoking, draft from air conditioning or heating. So what can I do to help myself? If you are having this condition, what can you do? One, the common thing you can do is the use of artificial tears. No, it comes in gels in suction or in an ointment. So these are readily available over the counter. You can easily get them in pharmacy to relieve the symptoms of the dry eye. It's a first line therapy, and they offer a temporary relief of the dry eye symptoms. Provide an important replacement of the naturally deficient tears that our eyes produce. So these are just the logic behind the artificial tear. However, it is advisable to avoid artificial tears that contain preservatives. That is, artificial tear with preservative. If you need to apply the artificial tears for a prolonged period of times or in very frequent times in a day, because some of these preservatives, they are chemicals that can as well accumulated in the body, causes some vessel dilatation, and as well even worsen the dry eye disease. So the artificial tears, they are just lubricants, and we have many of them that we can use. Wearing glasses or sunglasses that fit very close to the surface to our face, this can also can help us to slow down the evaporations of the surface of the eye. So the rationale behind this is to reduce the evaporation of the tear. So if we wear a glasses or a sunglasses that fit very close to the eye, that can be achieved. Indoors, an ear cleaner or filters dust and other particles can help to prevent the dry eye. Like I've said, one of the triggers is dust. Some of these dust or particle can plug some of the pores or opening whereby the tears come out to the surface of our eye. A humidifier also may help by adding a moisture to the environment where you live in. Avoid dry conditions and allow your eyes to rest when performing activities. So especially when we have some tasks to do, in between our tasks that entails that we stay for a very prolonged period of time, we should give some time to let our eyes to rest. That requires you use your eyes for a very long time. Is instilling lubricants or eye drop during that time will also help. So if you know you are going to spend some time, some computer, you have some readings to do that's going to take a prolonged period of time, you can help yourself with the use of some of these readily available lubricants over the counter. Then remember to blink regularly. That is another way you can help yourself. You must regularly blink when you are reading or staring at the computer screen for a long period of time. This is where the use of phones or the use of personal computers has an increasing risk to dry eye. But many of us will get so carried away with whatever we are doing on our screen, and we forget to blink regularly. And after a short period of time, the surface of the eyes is going to get dry, and it's going to give us some signs reduce screen times as much as possible. And in the hospital, how do we treat dry eyes? How dry eyes being treated? It all depends on the causes of the dry eye. Like I've enumerated many causes of the dry eye. So your doctor is going to find out what is the causes and what is the best approach to use to relieve the symptom. First priorities is to determine if the disease, if there's underlying causes, if there's underlying disease that's causing the dry eye, such as Sjogren's syndrome, like I've mentioned before, or lacrimal or meibomian gland dysfunction. If all these are the causes of the dry eye, then the emphasis will be how to take care of them. If it is there, the underlying need, then we take care of them. If dry eye results from taking some of the medication, like I mentioned, maybe hypertensive, and you are on some antihypertensive drugs, or you have some nasal discongestant, you may have to consult your physician, complete to them. Then they will know that this is as a result of the side effect of the medication. In some cases, they might change you on another drug. If the contact lens were the problem, your eyes care practitioners will recommend another type of lens, or reducing the number of hours you put on your lenses, your contact lenses. In the case of severe dry eye, your eye care professionals may advise you not to even wear contact lens for some time. Or another option is to plug the drainage holes. The oily tears that are produced in the eye has a passage whereby they drain through. Okay, they drain through into a lacrimal duct. There's an opening that drains the tears into this duct. That opening can be plugged. You can plug the openings. You will have a lacrimal plug. They are also called contact plugs. This can be inserted. It's painlessly by an eye care professional. The patient usually does not feel any pain when this is done. These plugs are made of silicones or collagens that are reversible. After some time, it could be removed. So this can limit the amount of tears that is going to flow away from your eyes, so that there will be more tears, to lubricate and moist to the surface of your eye. In the severe cases, there may even be a permanent plug of some of these ducts that have been mentioned. In some cases, surgeries could be done. There are some simple surgery, like contact cautery is recommended to permanently close the drainage holes. In some cases, the procedures help to keep the limited volumes of tears on the eyes for a longer period of time. And in some patients with dry eye disease, supplements or vitamins can also be of help, like an omega-3 fatty acid vitamins. They decrease the symptoms of irritations that we are facing. So in summary, dry eye disease is a very common eye problem, which is and everybody is at risk. There are so many causes, and then I want you to know you are not the only one at the risk. It's almost everybody. But there are things in which you can do to help yourself. So we have come to the end of these sections. We are now time for questions and answers about the dry eye disease.
Okay, thank you, Dr. Olukotun, for that. We do not seem to have any questions from the audience, but what's the normal rule for screen time or for your laptop? I've heard about the 20-20-20. What does that? Can you elaborate more on that?
What it means is that after 20 minutes, it's advisable to look away. Blink frequently, like up to 20 times. Take some time again before removing. So this will help you to lubricate the surface of your eyes and then keep your eyes healthy. So that's what it's all about.
Okay. What if? So how many times do you get your eyes checked?
It depends on, for example, if the dry eye is a mild, because it could be mild, it could be moderate or severe. So once in every 6 months, in some cases every year, but it's advisable to at least have an eye check yearly, make it a yearly. But sometimes if you already are diagnosed of some of the eye disease, maybe like glaucoma or other thing, it may be more frequent, maybe every 1 month, or you have a diabetic eye disease, a proliferative diabetic eye disease. The doctor may need to see you maybe every month, sometimes every 2 months, 3 months, 4 months, or 6 months. So it varies depending on the underlying ocular conditions.
Okay. And what if someone has something in the eye? Should they, maybe you are playing sports and something gets in your eye, what actually are you supposed to do?
First and foremost, it depends on what gets into your eyes. If it's just ordinary, maybe like a specs that gets into your eyes, the first thing is to get it out. And there are ways in which you can get it out. And after that, you should be on a lubricant for some period of time, so that maybe there's any remnants of the particles that are still there, then the lubricant can wash it away. You know, I made mention that one of the functions of the tears is also to wash away some of these lubricant. But sometimes, if other things get into the eyes, like maybe a chemical, an acid, a base, that is an emergency, it's an ocular emergency. You must find your way to an hospital immediately, because if urgent steps is not taken, then there's a risk of loss of sight. So these are some of the points that you need to know. But if ordinary particle, maybe a grain of sand or ear strand enter into your eyes, with the help of the lubricant, you can find their way out.
Okay. You said if they have further questions, they can go to our website at www.eyefoundationhospital.com, or they can send an email to info@eyefoundationhospital.com. All right. Thank you so much, Dr. Olukotun. We've enjoyed this session, and thank you for joining us.
Thank you, sir.
All right.
Thank you for listening to the question and answer.
Talking to you.
Yeah.
All right.
Thank you so much for being part of this program. So we look forward